Hi, we're going to continue our conversation with Clemencia Solorzano, who is a pharmacist, as we celebrate Pharmacist Weeks. We already had a conversation about medication safety, some tips to getting your prescription and what it's like to be a pharmacist, and some of the schooling that she had to go through, which is an awful lot of schooling to become a pharmacist. So we appreciate you being here and continuing this conversation. Welcome back and welcome to any viewers that we have today. So Clemencia, could you just tell us where you work or what you do? What is your position as a pharmacist?
I have been a pharmacist for 30 years and I work in a hospital. I've spent my 30-year career in a major hospital.
When it comes to patient safety or medication safety, what are your thoughts on medication safety? What does that mean to a pharmacist?
Medication safety is, for us, would mean getting the right medication, understanding for the patient to understand how to take it correctly. Medications are used to treat conditions, but they also sometimes have side effects, and sometimes, depending on how you use them, if used incorrectly, can cause a big patient safety problem. They can hurt a patient. And so if I'm to think of medication safety as a whole, there are things that institutions can do to encourage safe medication in patients, and there are things that patients can do themselves to make sure that the medications that they take is being taken correctly, is being stored correctly, and is giving them the actual result that is intended. So if you got a blood pressure medication and you're taking it the way it's supposed to be taken, you would expect that your blood pressure should come down. And if it doesn't, that's something that needs to be addressed. And so when we talk about safety, it's the right medication for that patient being given and taken in the right way.
And interactions, right? So we have to keep track of all our medication and over-the-counter medication.
Over-the-counter medication especially, because when you go to the doctor, you should have that list of medications that you're on. It helps your provider to know what medications you're taking right now, because that will prevent duplicate medication therapy. It will also let them know sometimes your medications get reassessed, and so you may have been taking something for a broken ankle, some pain medication, and you don't need it any longer, so that should be taken off if your problem has resolved. And so it should constantly be updated, and it should always be brought to the to your clinic visits so that it can be reviewed.
People getting to be my age and getting up every hour at night to go to the bathroom, it might just be our medication.
Well, it might just be it might just be when you're taking your medication, not that your medication, it's actually part of why you're taking the medication, but there are ways to take the medication so that you really don't have to run to the bathroom at night.
Something to think about. We complain about going to the bathroom. We all think it's part of going, aging, and it might be just a medication. Well, I want to thank you for your time again, and it's a great conversation. And we are celebrating Pharmacy Week, October 18th to 24th, 2020, and we're here with Clemencia Solorzano, and getting a lot of information about medication safety. So thank you for that, and we will have another part tomorrow. Hope you will all tune in for that. Thank you.